All right, it's time for part 2 of the great peptide debate. Now, I've been talking a ton about peptides on my channel and regenerative medicine, biohacking, things that I'm super passionate about and have given me tremendous tools in my toolbox to help people overcome just all kinds of illnesses and diseases. And again, we're combining these strategies with traditional medical strategies and seeing excellent clinical results in our practice. Now, one of the biggest pushbacks that I'm getting when I discuss peptides is where are the randomized controlled studies? Now, I've talked about it quite a bit. There are so many reasons why there's not randomized controlled studies in the world of peptides and also in the world of biohacking and regenerative medicine, but let's focus on peptides. Now, number one, the amount of money it takes to do long-standing randomized controlled studies is staggering, and we've discussed this before. There are also players involved where some people have a lot to gain and some people have a lot to lose. And so there's a lot of dynamics going on in the background when it comes to looking at these things. Now, I'll tell you what I've seen as an expert. Now, first of all, I'm not coming as an influencer. I'm not coming as some conspiracy theorist. I'm coming as somebody that has spent my entire life thinking about pharmacology, systems biology, physiology, right? I've treated over 25,000, patients in my clinics throughout the years. And so the preclinical data, as well as the human data, is very interesting in peptides. The preclinical data shows us tremendous potential for so many of these peptides we talk about. The human data, although not specific enough and not with the randomized controlled studies enough to say this is the absolute gold standard for this or that, it does show excellent safety profiles. Now, if you want to disagree with that, please leave the comments below and I'll answer every single one of the concerns when it comes to safety. Now, there are some potential theoretical, safety risks, and we know that certain peptides are going to react with certain medications. That's why I always say, hey, you have to consult with experts if you want to do peptides. I just think that that's a better way because I know a lot of you are dosing yourselves and doing other things, but you don't necessarily have the expertise to understand how you could be harming yourself. So this is talking about having experts kind of guiding care, but arguing that we should not be exploring peptides in humans, given its safety profile, given the preclinical data, and given the fact that this is how science is done. We allow the experts to push the bounds of what's possible in science. Of course, we're going to do everything we can to protect our patients from any type of harm. But we have so much disrepair and dysfunction in our society. People need options outside of traditional medicine. And peptides, regenerative medicine, and biohacking is one of those strategies. So let me know what you think about this great debate. I really do enjoy talking about these things, and I'm so excited to be getting so many DMs and outreach from physicians, from other providers, from clinics, wanting to know what our experience is, wanting to partner, wanting to get like minds together to really make an impact and a difference, because I am not the only physician out here that is noticing that we are in a bad place right now. And we are having patients getting sicker and sicker, and we need other options for them other than what we can offer them in traditional, medicine. Let me know what you think. Let's get this debate started. Sorry for the long, winded discussion, but it's time that we have it, and let's make an impact in humanity and get things better. We'll see you next time.